Hello everyone, and welcome to this audio podcast. As part of this Meteor edition, audio podcast as part of a Labostix Meteor. This audio podcast is part of a Biome Bullet. This audio podcast as part of the abstracts. This audio podcast as part of a Storm Labostix production. Through this audio podcast today, looking at abstract as part of works put forward for the British Society of Lifestyle Medicine, or BSLM, in around 2019, and where the abstract had been put forward for peer review publication in around the sort of same sort of duration, around 2020, around 2020, if not earlier. And so this abstract is a sort of a, well, this works as a collaborative between collaborators amongst a particular social media platform, the Renal Patient Support Group, the RPSG, and also a collaboration between academia, in academia, part of collaboration as part of a collaboration in amongst amongst an academic institution in the United Kingdom. So the abstracts around this works and looks at a need, and sort of a need. Is there a need for healthcare scientists and educational support surrounding chronic kidney disease, or CKD? So patient access to information support to supplement understanding of laboratory and test parameters faces challenges owing to the medical and scientific terminologies. These challenges have led to exploration or investigation of new and efficient ways of approaching educational and information support for recipients with long-standing conditions like chronic kidney disease, or CKD. And around the objectives of the where the objective was to investigate the perspectives relating or pertaining educational support surrounding chronic kidney disease laboratory investigations from a sample of the Renal Patient Support Group, the RPSG social media platform. In around the sort of methodology aspects, the research team carried out five polls for around 6 months, between January 2018 and July 2018, through the RPSG social media platform. The RPSG sort of a closed social media platform to help understand the importance of healthcare scientists' educational support for laboratory tests and investigations. A target sample, sample of 1,000 out of 8,000 responses was set, and the sort of justification was where the at the time the RPSG had in around a total of 8,000 members, and sort of more recent times, the RPSG has over 10,000 members. However, a sample of 1,000 out of 8,000 responses was set. In around the analysis, 574 RPSG members participated in completing polls, representing in around just under 10% response rate. And respondents polled yes, access to healthcare scientists in amongst primary care would be advantageous in around where the response rate was around 77%. And when asked about what technology solutions are are available through general practitioners or primary care physicians, and amongst transplant centers or units. A portal allowing access to medical records and laboratory results were the were were some of the were some of the highest responses were in around 26%, around 26%, and respondents also polled in yes to a remote healthcare scientist, a remote healthcare scientist through a computer or a desktop app in around 33%. And so, in amongst sort of the discussion and sort of conclusions, sort of aspects of this abstract, chronic kidney disease recipients see a mixture of healthcare professionals relating to laboratory investigations, and as such, recipients or patients could receive misinformation or can receive misinformation. So education relating to tests and investigations should potentially come from healthcare scientists. In around the conclusions, the polls conducted had added value to an important topic of scientists' involvement surrounding education of laboratory investigations for chronic kidney disease or CKD recipients, and there is now potentially more scope where scientists could support CKD or chronic kidney disease recipients with smaller education surrounding laboratory investigation and parameters. Some literature, some terminologies to identify similar literature include healthcare scientists, nephrology, and technology. That draws this audio podcast to a close. This audio podcast as part of a Meteor edition. This audio podcast as part of a Labostix Meteor. This audio podcast as part of a Biome Bulletin. This audio podcast as part of the abstracts, and this audio podcast as part of a Storm Labostix production.